I think it's an interesting question you bring up because to me it highlights the fact that pain itself consists of several different things, actually, several different mental constructs. One of them is the way that it feels, obviously. It hurts, right? But there's also a couple of other things that are going on. There's, as you said, the autonomic response. So the fact that you're getting nervous, you're getting aroused, as well as the fact that the funny thing about pain is it draws your attention. It says, look at me, look at me, look at me, right? So to ease pain, there's the way you can ease the pain directly, the feeling, with analgesics, aspirin, morphine, these kinds of things, opiates. And if you like, you can attack the attentional aspects. Now, that's kind of strange. And I was just talking to these panelists beforehand, actually. If you can believe it, I was talking about using, for example, let's say hallucinogens for pain management. Let's suppose a person is in some kind of end stage of some wasting disease, so they're taking heroin, and the heroin doesn't even ease the pain. Well, how about if you take LSD? That's right, I said that right. LSD. Now, the thing about LSD, what it does is, you can imagine it's kind of like an equalizer, where you have like, this is kind of low, this is kind of low. Whatever it is that's painful is turned all the way up and it's saying, listen to me, and then other things are low. What LSD does is it kind of goes and turns everything up. It doesn't ease the pain. The pain is still there, but it's not any more important than anything else. So if you take the LSD, you can then say, well, I can think about other things. I have the pain and I can feel it, but it isn't grabbing my attention and holding me hostage. So that's the thing. Pain is not just the way it feels. It's also grabs your attention. It's also an autonomic response. It's at least three different things.
I think the problem with LSD for pain management would be just functionality. We'd all be sitting in a small room, perhaps happy. Electrocurrents have a lot of promise for doing this sort of nudging thing where we can complicate the stimulation to the spinal cord using things like interferential current, two sine waves that intersect at the cord, nudge the body in just a certain way that we can cause the brain to think it's having pain. It starts producing that nice cascade of healing hormones and can help with endorphin and enkephalin production. So I think the Russians have been very, as early as the 30s, very interested in electricity and using electrocurrents. Interferential current is a common one that we would use in a clinical setting to really lower the pain level in acute back pain.